no matter how good the doctors are, I think we are the difference because we take really care of the patient and their family. The doctors do their job, and there's a difference in nursing and the medical profession. I think nurses are so much more there for the patients and their beloved ones.
Absolutely.
Advocate for them. That's to be an advocate for your patient and your family, the family of patients. That's so important part of the job.
Hello, and welcome to the Art of Emergency Nursing podcast. This is where we share stories for inspiration, entertainment, and encouragement, because we all know emergency nurses have the best stories. Now here's your host, Kevin McFarland.
Hey everybody, Kevin McFarland here, and I'm thrilled to say that this week on the Art of Emergency Nursing, we have our first international guest. His name is Joop, and you may recognize him from the National ENA Board. He's a nurse from the Netherlands, and he's going to share his experience as a nurse there with the rest of the world to show us some of the differences and similarities between our countries. I think you're really going to enjoy this interview, so sit back, relax, and enjoy this interview with my guest, Joop. I'd like to just talk a little bit about what it's like being a nurse in the Netherlands, because that's not something that most of the people who listen to my podcast are going to be familiar with. And my guess is it's exactly the same as being a nurse in the U.S.
Yes, I think so. But being involved in ENA and getting to know a lot of American ER nurses, there are, I think, a few differences.
Okay.
Well, you got things good, and we got things good. I think the ideal would be a mix of the two. That would be perfect, I think.
From what you've heard from nurses in America so far, what would you say are the main differences?
ER nurses in the Netherlands are in charge of the whole process. So we do our own, like, plasters. We do our own IVs and things like that. We don't have the techs on our departments, so we have to do everything ourselves, and we can take care from the patient from the minute it comes in until the minute he leaves, either be it to be admitted or to be discharged. That's, I think, the differences, and the length of stay you have. That's quite amazing to us, because in my hospital we have a maximum length of stay from 4 hours, and if it's over 4 hours, we can let the patient stay for 2 more hours, and then there has to be something arranged, either being admitted or being discharged. So.
Wow, I like that. That sounds amazing. And
the crazy thing, I spoke to somebody at ENA last year, and they said, we had a psych patient in for about 10 days. I said, well, that's unbelievable. Even psych patients go from our department within 6 hours.
Wow, that's amazing, and I think most nurses in America would be absolutely envious of that position, because we have, I have in the emergency department that I work with, where I'm a house supervisor. It's not uncommon to have patients in the emergency department for over 6 hours. It's not uncommon. It's not, super common, but it's not uncommon. And behavioral health, I mean, we have behavioral health patients there for days waiting for bed availability.
Oh, that's crazy.
It is. It's
and
just
I think, if you look at the behavioral health patients, the ER is definitely not the place they should be for that long.
Absolutely. It's a terrible environment for our behavioral health patients. So, what are some of the other differences you've found?
Well, you got all the different degrees, like LPNs, RNs, you got nurse practitioners, APRNs, and things like that. And we don't have that in my country. We have RNs who have emergency nursing training, and we have a few physician assistants. So those are nurses who, after their ER training, did the physician assistant training, and that's all. And we got our medical staff, but in nurses we only have we have student nurses, and PAs. That's all.
So are the PAs in the Netherlands then nurses?
Yeah, they're nurses, and they did an additional training for about 2 or 3 years, and then they become PA, and they do sort of the minor cases in the ER and treat them themselves.
Gotcha. And now this is will show my ignorance, and I apologize. Do they have the different education levels? Like here we have ADN, BSN, MSN. Does the
Yeah,
Netherlands do something
we do
similar?
have we got what we call level 4 and level 5, and level 5 is like BSN, and level 4 is one level below. But the funny thing is, in the Netherlands, they both get the same pay. They all are
Yeah.
considered registered nurses, and
Yeah.
they're all in the same register, central register of nurses, and they get the same pay. And that's something which is likely to change in the future, because we do think some diversity in levels is good. And when you have a BSN in nursing, you should be paid accordingly to it.
Yes.
But at the moment, it's still, well, rather debatable.
Yeah. Do you do like national certifications in nursing? Like we have the CEN here. Do you guys
Yeah,
do the
we do
CEN?
the sort of the same. We, after our initial nursing training, you become a RN, our equivalent. We don't call it, we call it a registered nurse. And after that, you do your CEN. It's about 1.5 years, and you're going to start working in the ER and follow the training. And the training is mostly hospital based, or it's based in the bigger hospitals, and people from other hospitals go to those bigger hospitals for the CEN training. But the training is, well, certified by a central board of certification, and they oversee the training. Every hospital has to apply to become a certified training center for ER nurses. And I'm one in the board of certification. I'm a representative of the Dutch ENA in the board of
Nice.
recognition. So, and we go to hospitals and check if they, because it's all sort of a paperwork they have to deliver, how many hours the students work, how many hours they go to school, what their achievements are, which patients and things like that they see. And we go to every hospital in the Netherlands in about every 5 or 6 years, and we do sort of an audit of the ER concerning the nurses training there.
Nice.
That's fun to go there.
Oh, I bet it's fun to go and see how different hospitals. Do you find a big variety between how different hospitals perform?
Yeah, I think so. We got, like we have different levels of ER. So, and well, if the system in Holland is, if you train nurses to become ER nurses, and once they get certified by the board, the hospital gets a refund for the education costs. But you have to have a certain level of education, and especially the small hospitals find it very hard to comply with the level of education, especially the severe trauma cases, the resuscitators, the very sick children, things like that. So they send their students to bigger hospitals. And, well, that's a bit tricky, I think, because they get under their certificate stays, they're a certified CEN, and they are capable of taking those heavy cases. But if you do a 6-week or 8-week rotation for those patients, you're not capable of doing it, I think.
Yeah, you're not quite as ready.
We are working on right now, and we're working on a new system of education. It's called flex education. So the whole process of certification for ERs is being split in different modules, and people can follow those modules. And the very sick cases, like the big traumas, the research, the very sick children, are a separate module. And what we anticipate is that in the near future, you get a basic level for CEN, and if you do the really severe cases on a regular basis, you get the extra module and you get an extra certificate for that.
Nice.
I really would incorporate in those flex levels is that we have a huge shortage of nurses in the Netherlands. And what we would like to see is more flexibility of nurses. So in our hospital, we have a program where certified nurses start with the ICU training, and after that they follow the ER training, so they can work on both wards, and they regularly shift between those wards.
Nice. That's a great idea it's a great idea to get nurses that are kind of interested in that critical care patient that can go both ways and do either ICU or ER. What a great idea.
We are doing the same with the paramedics as well. So colleagues of mine are trained to be a CEN, and then they go to the paramedic training and vice versa, and they rotate for every 3 months. There are 3 months on the ER, 3 months on the paramedic service, and that's really great because you get so much more interaction. And what we used to see is quite a difference in education, in communication skills and things like that, and that's disappearing quite because we now know from each other what they do and how they work and things
Absolutely.
like that.
And is paramedic a separate level there as well, or do a lot of nurses?
Yeah, after paramedics are nurses in the Netherlands who are trained. And after that, they do either ICU or ER training, and then they do the separate paramedic nursing.
Wow. Okay, so they're nurses first.
Yeah, they're nurses first.
Interesting. That's really interesting.
Mm-hmm.
That's kind of cool.
Yeah, we think you should have a basic nursing skills and very basic nursing capabilities of like critical thinking skills and things like that. And you learn it by working with patients in a hospital.
Yeah, absolutely. Huh, that's interesting. What do you think are some of the things you'd like to bring from the United States from what you've heard that you think would be a benefit to bring to the Netherlands?
Oh yeah, we don't do a lot of nursing research, if you know what I mean. Nursing research is just started in the Netherlands, and when I'm over there, I'm always jealous about all the nursing research that has been done by all our colleagues in the States. It's so amazing, and we can really learn and benefit from you in that field because we're not used to doing research on our ward. We just have to work and get those patients out.
Gotcha. Well, with the 6-hour time limit, you don't have time to mess around. You got to get them out.
Yeah, that's true. But we're getting there. It's becoming more or less. We're getting familiar with it. And in my hospital, we have one nurse now who's following the separate nursing research education. So we're getting there.
Nice.
And what I also would like to see is the amount of proudness you are on your skills and things like that. Nursing is far more a respected profession in the States than it's in the Netherlands.
Interesting.
When I say I'm a nurse, you always see them thinking, "Oh, you weren't smart enough to become a doctor." You know what I mean?
You're like, no, I was just smart enough to not.
I'm kind of smart, and I could have followed med school, but I wanted to go into nursing.
Yeah, it's just a different world. It's a different calling.
Yeah, I think
different.
Yeah.
Yeah, I know folks who were nurses that then went on to med school, and they end up being great doctors because they already know the patient care and that they just have that down. Yeah. So interesting.
Mm-hmm.
Well, I'd like to think it's a respected profession in the U.S.
It is. Trust me, it is.
How does the pay compare in nursing in the Netherlands to the rest of the country?
Well, it's not that well paid.
No.
If you go into IT or in finance, you get a lot of more money. But I think your work should be fun, and I think nursing is fun. But I don't know how it compares compared to the level of pay in the States. I really don't know. I'm not secretive about it. I just did my tax form about €70,000 before tax a year.
I'm not sure how that compares. I think most
That's
nurses.
about, let me schedule, about 85,000
Okay.
US dollars.
That's not incomparable to here. I mean, that's I think a lot of ER nurses are probably in that 85 to maybe the more experienced ones are closer to 95.
Yep.
But
Yeah.
that doesn't seem like that's too far off.
No, I don't think so. But we don't have the huge well, you have to pay for healthcare quite heavily. We don't. We pay about, let me see, about, what do I pay? €140, about 160 US dollars a month for my healthcare coverage. And everything is covered. Even the dentist service, like hospital, the general practitioner, meds, things like that, all is covered.
Everything's covered. So no additional out of pocket. Once you pay your insurance, you're good.
You get everything. Well, just not normal things like Tylenol and things like that. Well, we don't even prescribe them because it's very cheap to buy them at the local pharmacy. But things like that aren't covered. But I don't think that's necessary. But every other medication, like antibiotics, things like that, everything is covered.
Wow, that's pretty cool.
Yeah,
that's definitely a difference from the U.S. where
you can't. And the big advance is everybody's insured for healthcare costs. So, and the insurance companies can't kick you out.
That's nice.
I think, that's good. So if I'm getting real sick, and I hope I'm staying healthy, but my healthcare plan can't kick me out.
Yeah.
If I'm too expensive. And another thing is we don't have the big, liability cases as you guys have, where nurses are hardly sued any in the Netherlands, and medical staff neither. We don't have the system that you get millions of damage payments and things like that. The highest amount of payment patient who got really badly treated by a doctor was about $500,000 euros. It's about $600,000. So
here it's boy, they do punitive payment. Punitive.
So we don't have lawyers in our waiting rooms and things like that, like you have.
That's good. You're lucky there.
Yeah.
So, well, that's interesting. What are the big things that you think are kind of alike between the two?
Well, the increasing workload. We see an increasing workload every year, I think. Another thing is the patients are getting more. Well, they think they're more informed when they go to the hospital. They all do the Google search and they say, "Well, I got this and that, and you should treat me like this." If you know what I mean.
That's universal. That's good to know.
That's universal, and I hate that.
Yeah. You're like,
and I don't know if the same in the BC, the nursing workforce, the age is getting higher and higher because we see not many young influx into nursing lately. So
interesting. That's interesting. It's probably fairly similar. I mean, I think certainly the nursing is an aging workforce, but I mean, there seems to be, there's a lot of people waiting to go to nursing school too. So,
when I forgot to tell you, in my salary, that's also my pension plan included. So my employer pays my pension plan.
Nice. So there's a pension for once you're too old to work.
Yeah.
Nice.
And it used to be at 65, but the government really recently changed it. So now I'm going to retire at 67 or so if I want to stay working till I'm 67, if you know what I mean.
Yeah. And then after that, is it kind of an expectation that you'll stop working, or do people typically work longer than that?
No, that's the expectation you start working. I think after all those years, well, you should be allowed to stop working after that.
Yeah, and I mean,
if you've been in nursing for that long.
Yeah, how long have you been a nurse?
Oh, I started way back when I was 18, so I'm in for 42 years now.
Holy
with
smokes.
my training and things like that. And way back, it was compulsory to go into the army for a year in the Netherlands, so I did that as well and things like that.
Okay, so you do a year army when you turn 18 or whatever.
Yeah, I did it after I finished nursing school. So I joined the Army Medical Corps for a year, and this was kind of fun. But it's now, as we don't have what do you call it? What's a good word? You're not obliged to go into the army anymore. We have just regular soldiers who are soldiers for the rest of their lives. It's a real profession. It's not like you have to go there.
Gotcha. And what made you decide to get into nursing?
Well, at high school, I didn't actually know what to do, and I was kind of fed up with studying, and I thought, well, what's the profession? And way back when I started, when you go to nursing school, you get paid immediately because you started working and learning on the job, so you get paid immediately.
Oh, wow.
That's what I thought, but I never regretted it. I think it's the greatest job in the world.
I agree. At what point in your career were you like absolutely sure you made the right choice? So like at what point were you like, yep, this is what I'm meant to do?
Oh, I was after my initial nursing school, I did ICU training I worked on ICU for about 7 years. And, well, I thought that's it. Being on the high-tech machines and respirators and kidney machines and things like that. Oh, I really loved it. And then they asked me for a summer rotation to the ER. And I said, well, I don't think ER is something for me. And after 2 days, I said, I'm lost. And I never went back to the ICU. I thought, this is it. And I'm still thinking ER nursing is my kind of thing. I really like it. And I never considered going into management or things like that. I just want to be an ER nurse.
Yeah, that's awesome. What a great feeling to find your niche and find your where you're meant to be.
Yeah, and I think, well, I tend to what you call invest in myself, doing my courses, read literature and things like that, and that's, I think, vital to be in the ER nursing. And I see colleagues my age who don't do that, and they kind of burn out after quite so many years. But I don't feel burned out. I still love it. I learn new things almost every week, and I read about new things, and that's great.
Yeah,
it's such a lively profession, ER nursing. It changes new things. It changes constantly, and things we did 10 years ago, we laugh about it now, and that's so good to see and be part of it.
Absolutely. Speaking of change, tell me about a patient that changed the way you practice.
Well, let me see. It was way back when I just started on the ER. I was a night shift, and we had a girl about 18 years who got brought in. She was run over by a truck.
Oh,
and we did all our things, but her mother was at our ER as well, and she was in the family room. And she went to ICU, and her mother later came back to me because I took care of her as well, and I sat with her and things like that. And she told me it was so stressful sitting in that room. And you know what's most stressful? You hear everybody walking on the corridors because we all were sort of wooden, Swedish clocks, and you hear people walking on the floor, and you think, now somebody's coming to tell me what's wrong with my girl. Now and you hear the footsteps passing by, and that was such a eye opener for me to talk to her and see how she experienced our care. And she was very happy with our care, but she said that's talking from that perspective that made me really realize that how important our job is as nurses. So we are there to advocate for the patient, but also for the family and the loved ones of the patient.
Absolutely. It's having been on the other side of the patient care equation there. I'll tell you that it's stressful. It's super stressful being a family member.
Yeah, no.
And and you're constantly wanting answers, and you don't get answers the way you want it, and it's
it's kind of strange. I remember when I was in the ICU, a very good friend of mine was diagnosed with esophageal cancer, and he got operated on, and he was on my ICU. And even though I know that he has because he had tumor everywhere in his body, and even I know that, like a professional, being involved with him, it's so it's so strange being on the other side.
It is.
And just recently, my father-in-law, who was very old, was admitted to hospital, and he was on the ER of another hospital. And it's so strange being there as a family member. And I'm not one of those who walks in and say, "Hey, I'm a nurse, so tell me what's going on." So I hate that in my job. So I try to be modest. And he was on the BP machine, not an arterial line, but the BP machine, and it was measuring every 5 minutes. So, and that's very annoying, if you know what I mean. It's very annoying. So when the nurse came, I said, "Well, can you turn that down for me, please? Because my father-in-law was in pain. It hurts quite much. If it pumps every 5 minutes, it hurts." And she said, "Well, no, we got to monitor his blood pressure." I said, "Well, if you look at his vitals, his BP hasn't changed from 105 to 110, just one. It's very stable, and it's very uncomfortable having a BP machine going on every 5 minutes. Well, we got to measure it every 5 minutes," she said. I said, "Oh." And she said, "Well, you do your job. I don't know what job you're in, but I do mine, and I'm the professional, so I decide to do that every 5 minutes." And I said, "Oh my God, if I ever turn into a nurse like that, shoot me."
She had no idea. She had no idea you were a nurse.
So when she was gone, I changed it.
That's funny.
Yeah, but I hate it when I do triage, we have people coming in with like hospital IDs on it. You know what I mean? And I think it's so annoying. I always not try to ask, "Do you work in our hospital?" I never ask that, because I don't think that they should be privileged because they work in a hospital, like say on the financial department or things like that. If you know what I mean?
Yeah.
And I hate it when people come in and they say, the first thing they say, "Well, I'm a nurse myself, so I know it quite well." I think don't do that to us.
I try to keep it quiet, but it ends up getting out. Like, when we did everything with my wife, everything happened in the system that I worked. So, I worked for the hospital where everything happened. So, it was quite known pretty early on that I worked there. And that's okay. I mean, they gave us amazing care, and I don't think the care changed because I worked there. I really don't.
No.
But it's, it wasn't something that I didn't walk in with my badge on and be like, "Hey, here's who I am. Look how important I am." Because my thought is always, you should treat us like we're important anyway.
Mm-hmm.
I was working at the local pediatric facility, and I was taking care of a patient, and everyone was making a big deal about the visitor who was in there, who happened to have a badge on, worked for the same facility, and I just didn't think anything of it. I didn't know who she was or what she did. She looked like she was in finance or something. So finally I asked, I said, "Well, I noticed you have a badge. What do you do?" And she's like, "Well, I'm the CNO. I'm the chief nursing officer." And I was like, "Oh, okay." And I was like, "Well, then I guess I better be nice to you." And she just kind of laughed.
Yeah.
She just kind of laughed, and I go, and she's like, "Well, she's like, you're doing okay without knowing who I am." And I was like, "Yeah, okay." She's like,
"I know what you mean." Yeah.
And she goes,
But I think it's funny when you got a real VIP in your hospital.
Yeah.
Because I think everything goes wrong because if we have a VIP, and well, we're close to the government center, so we do see our share of VIPs. So the head of departments come in, and they've been head of departments for some years, and they don't treat patients very regular. They just I know, you know what I mean, and I think it's always better to don't have the head of the department come and be your attending physicians, if you know what I mean.
No, not at all. I mean, it'd be a terrible choice.
Yes.
It'd be a terrible choice. So we had a senator that came into an emergency department I worked at, and they came and got me and another nurse, and they were like, "Hey, you guys are going to be the ones to take care of him." And we were like, "Okay." And it sounded like he was quite sick. And of course, the word got out pretty quick. And next thing you know, the dean of the medical school is down there. And the dean is, kind of just comes in to just make sure things are going well. And our dean is an ER doc. So, the senator looks at him and goes, "Hey, are you going to be my doctor?" And he goes, "Oh, no. He goes, "There's much more qualified people than me here to be your doctor." He's like, "I'm just here to make sure things go well." And, he laughed because the first words out of my mouth to the senator, I was like, "Okay, dude, let's get your clothes off." The senator started laughing. He goes, "I've ever been called dude?" And I was all, "Well, sir, here's the story." I go, "I'm pretty casual, but I'm pretty good at my job." So, and he just laughed and he said, "Okay," and he said, "Yeah, call me whatever his nickname was." He had some kind of weird, like almost boyish nickname. He's like, "Call me that." And I was like, "You betcha." And that's what I called him for the rest of his time there. And I remember the dean going, "Okay, how did you get on nickname basis with the senator?" And I didn't. And I go, "It's because I called him dude." We just kind of laughed. And he was...
You just have to treat VIPs like normal patients. Because if you don't treat them like normal patients, things will go wrong.
Yeah.
If you don't follow the normal hospital procedures and protocols, things will go wrong.
Absolutely. The CNO that I was there as a visitor that I was telling you about, she asked me, she said, she said something. She said, she goes, you seem very confident. You seem very good. How long have you been with us here at the hospital? And it was day 2 of orientation. So I'm sitting there going, do I tell her it's day 2? And I'm thinking to myself, and I go, well, and I kind of looked at my watch. I go, I'm on day 2. She started laughing. She goes, "I never would have guessed that." And I go, "It's not day 2 of nursing, and that helps."
No, that's because I kind of know how you behave, and you're so much a professional, I think. So.
Yeah, I said it certainly isn't day 2 of nursing. Otherwise, I'd be much more nervous than I am now. So, and she just kind of laughed, and it was nice. It was nice to, you're not gonna. I'll probably never see her again. I probably won't see her for the next 10 years of my career, but, and that's okay.
Yeah.
Tell me about the first error or the first medication error you ever made.
Oh, I nearly made one. I just got luckily stopped by a colleague. It was on the ER, of course, and a patient was getting really short of breath and overfilled with fluids, and she got sort of in a near recess. So we had to give her. Do you know Lasix?
Oh yeah.
Yeah. I had to give her 250 milligrams of Lasix, and they were the big ampoules. And I was kind of, because she was deteriorating very badly. So, and next to the Lasix were the ampoules with dopamine, and they were the same size ampoules. Mm-hmm. And I grabbed them from the medicine cupboard, and I kind of put in the syringe when walking. You know how the routine is. And I said to my colleague, "Look, here's the 250 milligrams of Lasix." He said, "No, you got 250 milligrams of dopamine."
Oh, no.
I said, "Oh, my gosh.
That could have went bad."
Yeah. So and that made me realize no matter how busy you are, always do your double checks, because that's so important. Because especially if you do a research in the resuscitation room, everybody's work together and they know the drill. But the unexpected ones, in a normal patient's room at the ER, if you have to do a research over there, things go different, and you don't have the supplies at hand, so you have to get everything in and things. And then if you don't do your normal drills and check and double checks, things will start to go wrong.
Absolutely.
And of course, I've given, say, 40 milligrams of Lasix instead of 90 or things like that. But those are minor errors. But the mix up between Lasix and dopamine, I was so glad I did the check on her and said, "Ooh, thank God."
Absolutely. Holy cow. Some divine intervention there.
Yes, it was.
Tell me about a patient who touched your heart, a patient that you'll never forget.
Let me think. Well, I saw a couple of them, but there was about 8 years ago a lady who came in. She was 8 months pregnant, and she got in a car crash. And well, she didn't seem that seriously wounded, and she was gone through all our trauma drills. And at the end of the trauma drill, the OB came in and they performed the ultrasound and found out her baby has died. And it was so shocking. And I sat with her and her husband and talked about it. And well, it was very emotional for both of us. And well, I went to see her when she was up on the ward for 2 or 3 times. And then after that, we kind of lost contact. And about a year later, I was walking in the hospital corridor, and someone said, "Hey!" And there she was with a baby in her arms. She said, "I just got this baby, and I'm so glad to see you." And well, that was really touching. Was that?
Holy cow! And that she would remember you a year later and be
yes. But I think we do make an impression on people because we are there for them. And it happens to me when I'm walking into town and someone says hi. I said, "I don't know who this is." You know what I mean? And they've probably been to our ER or something.
Yeah.
And somebody's just, it happens to all of us. They say, "Oh, look at me, I'm better now." And I said to my wife, "Who is this?" You know what I mean?
You're like, "I have no idea who this person is."
But you have to pretend you know who they are. I said, "Oh, you recovered well."
That's funny. Yeah, that's happened to me more than a few times. Yeah. And yeah, if you live in a small town, it happens probably even more. So
yeah.
But what's the best advice a nurse mentor ever gave you?
The best advice is be the nurse you want to take care of your loved ones. If you know what I mean, if you're a nurse, try to be the nurse who you want to take care of your loved ones when they're injured or when they're in hospital.
Yeah.
That's so important. If you remember that, it's so important.
That's good advice.
That's what I always tell my students.
That's good advice. It's good advice to...
Yeah. And always listen to the seasoned nurses.
Absolutely. So.
And if they say something's not wrong, and they don't have the whole critical think about it, but if they say something's wrong, trust them. It's wrong.
Sometimes that experience, they may not be able to quantify it, but it speaks volumes.
Yeah. Mm-hmm.
So, what other advice would you give a brand new emergency nurse?
Well, enjoy, and absorb everything. If you start an ER, there's so many things you see, learn. It's so totally different from any other type of nursing. So absorb and enjoy and think, well, this is what I'm going to do. And don't feel overwhelmed for that long, because you get the heck of it. You learn it. Everybody learns it. It takes some time, but enjoy. And that's why all of them as nurses, student nurses, enjoy your work, because it's the best job in the world you have.
Absolutely. The last question I have for you is a question called 3 things. And it's 3 things an ER nurse should remember and 3 things an ER nurse can forget.
Well, like I said, always remember how sick the patient is. There's a human being behind the patient. Don't treat a patient, but treat a human being. And that's one thing. Another thing is, like I said, listen to your peers, on the ones who trained you and the one who you're working with. Listen to them. And if they say listen to their advice. Don't be single-minded.
Yeah.
And be a member of a professional organization so you can keep up to date with your skills and your knowledge. That's so important.
Absolutely.
And things to forget is, that's hard, Kevin. That's a hard question. What should I forget in nursing?
Tough question. It's a tough question.
Oh, forget all the doses you learned by heart, because I think that's a blueprint for disaster. If you think you know all the doses by heads, that's a blueprint for disaster. Always look up, and if you know what I mean, never trust it. If you have, especially with children, if they say give 10 mics of that, think for yourself and look it up. Is it correct?
Absolutely. It's a good double check.
Yeah, good double check. And never forget, if you have to use one, what I always think, well, you should get superstition. If you guys get a medication order, you have to get like 6 or 7 files of it. I think, well, you should think, is this correct? Because this can't be. I normally don't need 7 files to give one shot of meds to a patient.
Absolutely. Oh my God, that's an easy double check of does this seem right? No, I don't think so.
Yeah. If you have to, and of course it's not completely black and white, but if you have to have so many files of something, you have to think, is this correct? But why should I need so many files of this?
Yeah, absolutely. What else should they forget?
Forget everything you learned in nursing school. No, just kidding.
Had a couple of people give that advice, and it's
yeah.
I think they say it a little tongue in cheek, but it's nursing school is definitely different from nursing.
Yeah, I think so. Yeah.
Now you teach. You're involved in teaching, aren't you?
Yeah, I am. I'm still the nurse educator on my ward. I'm finishing that job in September because I got so many other things going on right now, by being involved in ENA and things like that, which takes quite a lot of time. So I made the choice to quit that. But I always say there's a lot of things from nursing school you can forget on the EED, like all the theories about nursing programs and nursing styles and things. The ER is completely different.
So different.
Yes, I don't have to tell you, but you know what I mean. All the different forms of nursing, you have to forget all that in the ER. The ER is completely different.
Yeah, it is. It's a different world. That's for sure.
Yeah.
So, you mentioned ENA. You're quite involved in ENA. Tell me about that.
Yes. Well, I kind of got involved in ENA through TNCC. I was one of the first nurses in the Netherlands who took TNCC. And way back then, in the TNCC book was a brochure about ENA. And I kind of looked into that and said, well, that's a good organization because it's an organization of professionals. And I joined it. And so I gradually came in more and more involved. I became a member of the International Advisory Council. One of my big role models in ENA asked me to be involved in the 7th edition of TNCC, do some reviewing and things like that. And then I got into the position statements committee, which is great fun, and things like that. So, and then somebody said, why don't you run for the board? And I said, well, you crazy Americans, and you're never going to elect a non-US nurse onto the board, but it happened, and I'm here.
It sure did.
And it's great. I'm just getting into it, if you know what I mean. I started way back in January, and I'm just getting to know everyone and how everything works, because it's quite a big organization, but it's a very well-led organization. The people at head office are so good at their job, and they assist you in so many ways. And yeah, I'm getting there, and I'm getting more and more on my spot and know what to do, things like that.
what's been the funnest part about being on the board?
Well, the funniest part is being able to travel to the States so much because I love being there, because I think the United States are a great country. Not as great as the Netherlands, but they're second best.
All right, we'll take it.
I've been around the world. I've been around a lot of countries in the world, and I really love America because, well, it has its disadvantages, but the people are normally so friendly and they're so open to everyone. And well, I've been to India, for instance, and I can't imagine going to a country where there's so much poverty and think I can't enjoy my vacation. When I was in Delhi once, and I stepped out of my hotel and there were children sleeping on wooden boxes outside the hotel. And I said, you can't go on a holiday enjoy your vacation over here. You can't do that and make pictures of those cute, adorable Indian children. You know what I mean? I think that's not good. You should. So that's why I like the States very much. But I like to be involved in a professional organization like ENA. And trust me, it really is such a good organization. It's with all the resources and all the great members they have. A lot of them became very good friends of mine. So that's very valuable of being involved in ENA.
I think one of the things that I've always found interesting in ENA is you talk to nurses from all over the world. You talk to nurses from everywhere in the United States, and you find out that we all have kind of the same problems. Like we all have kind of the same problems. We're in various levels of figuring that out. But you find the experience is quite the same. Yeah.
And I can tell you, some of the problems are really global problems, like workplace violence, human trafficking, things like that. And the problems of the future, like multi-resistance bacteria and things like that, we have to cooperate worldwide. Otherwise, we'll lose the battle.
Absolutely right. Yeah, it's one of the things I've found the most rewarding and the most exciting about being in ENA. It's just fun, the shared experience, and getting to connect with people like you from around the world. There's a million people that just like you that I've never met, but I happen to meet you through our professional organization.
Mm-hmm. Yeah,
and that's exciting. That to me is one of the most exciting things about being in the ENA.
Yes.
So when sometimes when we're talking to patients or sometimes when we're talking to the public and people who are not in emergency nursing, and they'll ask us for your story. They always ask the question like, well, what's the worst thing you've seen? And they don't really want to hear the worst thing you've seen.
No.
Because they don't really want to know how bad that truly is. But what's your go-to? Let me tell you a quick story about the emergency department that's gonna get a laugh out of you. What's your go-to story?
Oh well, let me think. We do laugh a lot about at work, but you can't always you can't always share it with non-nurses because they think you were crazy.
Yeah, well,
we once had, and this is so. It happened to me a few years ago. There was a really big lady. I mean really big. About American size big, and that's big for us Dutch. And she was in the bed, and she wasn't that sick, and her husband was a very tiny little man, and he came out and he said, well, mommy has to do a poo-poo. And I said, what? Mommy has to do. I said, oh my God.
Oh Lord. You're like, that's going to be a challenge.
And it's big fun. If people tell you what happened to them, and a lot of them tell you wouldn't believe it. And I always say, I believe everything you tell me because I've seen it all. I've been there in all my years, and nothing is strange to me, but it's so funny working on the eye. It is big fun, don't you think so?
Oh, it's so much fun, and we see such a variety of people. We see the best of people, and we see the worst of people.
Yes.
We see people at their worst. We see people at their best, and we see moments that they would never want to share that they're sharing with us, and they're entrusting us to be there and care for them. Yeah. And
that's
it's amazing. And you're right. It's just a fun job. And my wife laughs. I have a part-time job where I work part-time as a pediatric emergency nurse. And I always joke that that's my fun job because I get to go and just be a nurse. I'm not a supervisor. I'm not in charge of anything. I just show up and I just go be a nurse. So I joke that that's my fun job. And she's like, you're the only person who would say that a part-time job, is fun. That when you're going over there and working, you're working over 40 hours a week. But you come home smiling and saying how fun it is. And I'm like, well, it is. It's a fun job.
It is.
So, and sometimes we see some bad stuff, and sometimes we see some,
Yeah, but I think that's one of the big challenges and one of the big pluses. You're there to make the difference for the people.
Absolutely right.
And no matter how good the doctors are, I think we are the difference because we take really care of the patient and their family. The doctors do their job, and there's a difference in nursing and the medical profession. I think nurses are so much more there for the patients and their beloved ones.
Absolutely,
advocate for them. That's to be an advocate for your patient and your family, the family of patients. That's so important part of a job.
Absolutely, I think that's one of the most important things we do.
Yes.
So. Well, Joop, that's all my questions.
Oh, it was quite fun talking to you, Kevin. But it's always, when I meet you at ENA, it's always fun talking to you. I can't
thank you enough for taking the time out of your day and getting on the phone with me. I really appreciate it. It's okay. No, I'm glad we were able to connect, and
yes,
I can't thank you enough for doing this with me.
Okay. It was great talking to you.
I can look forward to seeing you in Austin. I'll see you in Austin later this year.
Yes. So, say hi to Jenny.
I most certainly will. And thank you. One of the things I didn't get a chance to say is, you sent a card all the way from around the world, and I can't thank you enough. That just meant the world to her. And thank you so much.
Okay, well, it's my pleasure knowing you, and I feel I kind of know Jenny. Only through her picture and so, but she.
Hopefully, you'll get to meet her in Austin. I'm hoping to drag her with me at Austin. She doesn't like going to the conferences because she said I spend too much time with all these nurses and I'm too busy. But every time I go to a conference, everyone's like, "Well, where's Jenny?" Well, we want to meet her.
Yeah. Well, I know what you mean because everybody says to me, "Why's your wife going with you to the conference?" We said. It's no fun for her because I'll be away most of last year to be in Pittsburgh for 3 days because Pittsburgh is not that an inspiring city to be on your own for 3 days.
Yeah, no, I understand that for sure. My wife feels the same way. My wife's like, you're going to be hanging out with a bunch of ER nurses talking about ER nursing stuff. She's like, why would I want to go do that? And I had to laugh. I'm like, I get it. I understand. One of the coolest things about conference though is you see people. I see people that I see 2 or 3 times a year, and it feels like there's been no time passed at all. I mean, we just pick right back up, and
yes,
there we are, and it's a special kind of friendship. And one of the things that was really touching to me is when Jenny was going through everything she was going through for their transplant, the people who reached out to me the most of anybody, and my family. My family, of course, was there for me, and they were fantastic. But the people who really made it a point were my ENA friends. My ENA friends made a point to reach out and be like, hey, are you guys doing okay? What do you need? How can I help? What can I do? And that was really touching. I mean, I had people from all over the world texting us and cheering for us from all over the world, which is just super.
Yeah, we're one big family, I think. And
we are.
I'm so privileged to be part of that.
I'm glad you're part of that family. So
okay.
Joop, thanks so much for the time, and I'll talk to you soon.
Yes, okay. Bye-bye, Kevin.
See you in Austin. Bye-bye.
Thanks for listening to the Art of Emergency Nursing podcast. Make sure to subscribe to the podcast and follow us on Facebook.